Assalamu alaikum. Our presentation today and our lectures, free medical courses, will be on approach for history taking. For general approach for history taking, it's three parts. The history taking station. First is set, which is the introduction. Second is dialogue, which consists of present history, past history, medications and allergies, family history, social history, ideas, concern, and expectations, and lastly, the closure. For the set or the introduction, which is opening the counter, it consists first for greet the patient and introduce yourself and explain rule. Like you said, hi, I am Dr. Hadidi, SHO of Internal Medicine Clinic. And then you have to confirm patient details, name, date of birth or age. Are you Mr. Muhammad? Are you 55 years old? Then build good rapport by asking or saying, please have a seat. May I sit beside you? Then explain note-taking, which is very helpful to write notes during the station. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. At the end of the introduction, agree the agenda. I have received a letter from your GP stating that you have tummy pain. Is it right? Usually, for history taking starts with GP letter. Second part of the station will be for the dialogue, which is the main part of the station and concerned with gathering information. First point is present history. Start present history with presenting complaint or complaints. Sometimes not all complaints are mentioned in GP letter. Start with using open questions to elicit the presenting complaint in the patient's own words, which is the opening gambit. Allow the patient time to answer and never interrupt or direct the conversation. Like, I understand that you have been referred by your GP because of hand pain. Could you tell me more about that? What do you mean exactly by dizziness? Can you tell me what exactly has brought you to the hospital today? Then go further detail in the presenting complaint and from onset to date, clarify each problem if there is multiple complaints, each one of them before moving to the next, and help the patient to expand their presenting complaint. Use Socrates or Odbara as a numeric to memorize questions you should ask, and search for specific questions for each different complaint. So there is some questions I would like to ask. Is it okay? I would like to go through the story again to clarify some details. For the numeric Odbara, O is for onset. How did it start? Did it start suddenly or gradually? What were you doing at that time? D for duration. When did it start? For how long have you been feeling this? And progression, P. Is it becoming worse or improving, or is it the same? For aggravating factors, anything brings on, anything makes it worse. What makes it worse? And for relieving factors, anything makes it better, and what makes it better? And lastly, for the A associated symptoms, is it accompanied by any other problems or any other symptoms? Socrates first start with the site. Where exactly is your pain? Where is the maximal site of the pain? Is it generalized or localized? And can you localize it? For onset and duration, when did it start? For how long have you been feeling it? Did it start suddenly or gradually? For character, for the pain, usually we use Socrates for pain complaints. So can you describe how does it feel? Is it burning, stabbing, dull, aching, throbbing? What does it feel like? Does it ever change it? It's very important, especially in chronic pain. For radiation, does the pain go anywhere else? For association, is it accompanied by any other symptoms? And for the teeth timing and course, do you have it all the time? And when you have it, when do you have it mostly? For exacerbating factors and relieving factors, does anything make it worse or better? What makes it worse? What makes it better? For precipitating factors, do you know what might be causing it? Can you identify anything that tends to bring it on? Is it related to food, lying down or lying flat, or is it related to exertion? And at the end, for the S severity, on a scale of 1 to 10, how severe is the pain? If 10 is the worst pain you have ever experienced, and did the pain hurt the most at its onset? Always search for specific questions, and you have to memorize some specific questions for some complaints. For convulsions, syncope, and falls, you have to ask about pre-attack, during the attack, and post-attack. For complaints like hemoptysis, and bleeding complaints like bleeding rectum, you have to ask about and verify amount of blood and the effect of this bleeding and hemorrhage. For vomiting, diarrhea, and constipation, you have to ask about the description of the vomitus, color, odor, or stool. The present, again, in the present history, last thing is relevant system review. The aim of this relevant system review is to take and review affected systems in detail and take brief history for other symptoms. Like, do you have any other symptoms, or do you have any other complaints? Have you ever noticed weight loss? Also, there is different systems like cardiovascular systems. You can ask about chest pain, palpitation, orthopnea, lower limb pain, and syncope. Respiratory system, you can ask about cough, wheeze, dyspnea, and hemoptysis. For GIT, you have to ask about abdominal pain, vomiting, diarrhea, constipation, and dysphagia. For CNS, you can ask about headache, seizures, loss of consciousness, tremors, ataxia, weakness, and numbness. And for urinary symptoms or system, you have to ask about polyuria, hematuria, and oliguria. As mentioned before, for this systematic or system review, you will take brief history for other systems. We can also memorize the systems and system review as 4 main categories for symptoms. Main category as constitutional symptoms, which usually an infection like TB or brucellosis, or malignancy or lymphoma, like fatigue, night sweats, night fever, weight loss, loss of appetite, and lumps and bumps. For collagen disease like hand pain, back pain, skin rash, rash on sun exposure, mouth ulcers, sore in private areas, tight skin, and red eye. For endocrine disease like unusual hot or cold intolerance, changes in bowel habits, change in skin color, hair loss, excess hair growth, and problems in intimate relation. And for bloodborne or systemic sexually transmitted disease, you can ask about blood transfusion, sharing needles, tattooing, and unprotected casual relationships. Second in the dialogue is the past history. For the past history, usually start with open questions. Ask about any similar problems. Like, have you ever been diagnosed with any medical conditions? Previous hospital admissions. Have you ever been admitted to hospital? Previous operations. Have you ever had any surgeries, minor operations, or procedures? Blood transfusion. Have you ever had any blood transfusion? For closed questions, you have to ask about specific disease like hypertension, diabetes, ischemic heart disease, bronchial asthma, and stroke. You have to ask when it was diagnosed, complications, any treatment details, active problems, and follow-up arrangements. Do you have high blood pressure? Do you have high blood glucose, and for how long? What medications are you taking for it, and what was your last check? Are you troubled by any complications, and did you check it? Do you have any heart problems, kidney problems, liver problems, or chest problems? Then medication or drug and allergies, you have to ask about any medications. Is it ask for all current medications or even past medications, and ask for prescribed or unprescribed medications, any over-the-counter or herbal remedies. What is the indications and dose frequency and duration, if there is response to treatment and compliance on medication and side effects. Do you currently take any medications? What medications you are taking? Any over-the-counter, any herbal remedies? For what? And what is the dosage? And is your blood pressure or is your asthma controlled by this medication? Are you troubled by any side effects? Did you take any medication in the past, and for what? And did you notice any side effects from it? Also ask about allergies. Ask nature, severity, and what management was given for these allergies. Is there a personal history of allergic problems? Do you have any sort of allergies? Have you ever diagnosed with allergy? Have you ever had a reaction from medications? What is the time course between exposure and onset of allergy symptoms? Fourth point is the family history, which is very important and sometimes or even often neglected, and often it's important. Ask about all first-degree relatives' health, important disease like gland problems, joint problems, stroke, cancer, ischemic heart disease, and dyslipidemia. Any similar conditions in your family? Are there any illnesses or disease that run in your family? Does anyone in your family have gland problem, joint problems, or cancer? If any death in the family, ask about the age and cause. How are your parents? What did they die of? How did they die? Very important. For social history, it contains social history many points. We only choose points which are relevant to the patient complaint or your differential diagnosis. Many points, about 15 points: marital status, family members, and accommodation, occupation, availability of support, financial status, alcohol, smoking, caffeine intake, illicit drugs, travel history, diet, driving, pets, and sexual history. For marital status, you have to ask about health of spouse or partner and sexual life. I'm sorry to ask you private questions. Are you married? Do you have any partners? And do you have any partners is much better than are you married? Do you practice safe sex methods? For family members, do you have any siblings? May I ask males or females, and how are they? For accommodation, you have to clarify he is living in flat or house, or even living in nursing or residential home, flights of stairs or chair lift, toilet location, is it upstairs or downstairs, especially if there is disability. How are things at home? How many flights of stairs you need to climb? And do you have a lift? Also for occupation, you have to ask about present and previous occupation. What is the nature of work? Is the illness due to patient occupation, like in some cases of asthma, and effect of illness on work if there is absence? What do you do for living? What kind of work do you do? And how long have you done this work? Any previous jobs? What other jobs have you had? Have you ever been exposed to fumes, dust, radiation, or loud noises at work? Do you think your work is affecting your symptoms now? Are others at work have similar symptoms? Do your symptoms improve when you are away from work? Are you coping well, or are you on a sick leave? Also, for availability of support, we need to know who is the support. Is a family member, friend, neighbor, social services, or district nurses? With what? Cooking, cleaning, dressing, shopping, mobility, and how often is it? Once per week or once per day? What are the daily activities? Can you get to the grocery store or pharmacy on your own? Who is the one taking care of you? Does anyone else live at home with you? Can you tell me about him? Financial status. We need to clarify if the patient is threatened by current illness, or does he need disability allowance or unemployment benefits? Are you coping well? Can you afford it? Do you have any financial challenges because you stopped working? For alcohol, you have to ask about type, how much, and how frequent, and for how long, and if there is any change in drinking pattern. You ask, do you drink alcohol? How often do you have a drink? And what do you drink? What type of alcohol do you drink? How much do you drink per day or per week? And when was your last drink? And if it's in less than 24 hours, this might indicate a serious alcohol problem. How long have you been drinking? This much. And when did you have your first drink? Has alcohol ever been a problem in your life? When did it become a problem? And have you ever tried to give up drinking? What happened? How long did you stay off it? And why were you not able to stay off alcohol the last time? And also for alcohol, you need to know that 1 unit equal 8 grams of alcohol equal 10 milli of pure ethanol. And the safe limit of alcohol is 14 units per week. And also you need to know that 25 milli of spirit equal 1 unit, and half pint of beer equal 1 unit, and 1 glass of wine contains 2 units. For cage questions, which might indicate a serious alcohol dependence problem if answered 2 questions out of 4, you can ask, have you ever felt you need to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? Have you ever felt you need to drink first thing in the morning to steady your nerves or to get rid of hangover? This is the cage questions. After alcohol, you need to ask about smoking and quantify how many packs per year. So do you smoke? How much and for how long? What do you smoke? For caffeine intake, which might be important in some complaints like palpitation. Do you drink a coffee? How many cups per day? For illicit drugs, you need to ask, do you use any drugs that alleviate the mood? What exactly do you use and how? And do you ever share needles? For travel history, which is important in diarrhea or fever or HIV risk, have you ever been abroad recently, or have you been away out of the country in the past 6 months? Where did you stay? What did you do? Any freshwater swimming, getting tattoos, or sexual encounters? Have you received any vaccination or any prophylaxis before your travel? For diet history, which is important in malabsorption or vitamin deficiency, can you describe your typical diet? Can you describe your typical breakfast, lunch, and dinner? How often do you eat fast food? And has this changed recently? Have you changed your dietary habits recently? For driving in cases like syncope or hypoglycemia, which may be risk for the patient or others, do you drive? What type of vehicle? And for pets, do you have any pets like cats, dogs, or birds? For sexual history at the end, you need to ask, have you ever had casual unprotected sex? Do you have sex with men or women or both? Do you have sex with people who might be at risk of having sexually transmitted disease or HIV, like injection drug users, sex workers, unknown partners, gays, or bisexual men? Do you use condoms to prevent disease? What percentage of time you use condoms? Are there any other sexual relations that I should know about? For the end of dialogue, you need to ask about ideas, concerns, and expectations to explore how the patient perceives his symptoms and the treatment that they anticipate. For ideas, you can ask by, what do you think might be causing this problem? Do you have any idea as to what is going on at the moment? For concerns, are you worried about this being anything in particular? What are your concerns regarding this problem? For expectation, what do you think might be the best plan of action, and what were you hoping would happen today? At the end of the station, you have the closure, which consists of, or you need first to summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that it's important to you? Ask about any outstanding issues. So, is there anything else we might not have discussed? Is there anything else we haven't discussed that you feel is important? Create a list of problems. So I think you have a problem with your lung, which is called bronchial asthma, and plan the next step. I will examine you first. We may need to do some tests in the form of blood test, X-rays, pulmonary function test, and this can be done in an outpatient basis. Then I will decide whether to admit you or not. Then counsel on health promotion. If there is a smoking problem, HIV risk, are there advice? There are some advice I need to tell you about. Smoking is not good for your health, and I am going to arrange another meeting to help you to quit if you wish. Or you need to be tested for HIV, and I am going to arrange a meeting to counsel you and take consent to do the test. Check understanding. Is there anything unclear you need me to clarify? And at the end, thank the patient by name. Okay, I will be around if you need anything. Just ask the nurse to give me a bleep. Thank you, Mr. Mohammed. This is for closure of the station. Thank you. This is our next presentations.